Wonderful training experience during the war at the Valley Forge Hospital. And I came back to Hopkins after the war ended, and I wanted to complete my general surgery residency training. And I found myself in the evenings sneaking back to see what was happening to the plastic surgery patients that some of the other surgeons were taking care of at that time. And I realized I was really more interested in those cases. It was a marvelous experience. I don't think I could imagine a greater training program than the treatment of those massive injuries that were being flown in from all theaters of the war.
I thought about plastic surgery because it was different from surgery in general, because most of it was not, if you can't cure it, cut it out. It was restorative or rebuilding, and it appealed to me. So I went in the program, and there I met another mentor, Henry Royster, who was a wonderful Southern gentleman, fine surgeon, very paternalistic toward his residents, which I never was, and also very wise clinician. I think what probably going to be the next big thing is tissue engineering, and the ability in using stem cells to build on with the person's own tissue things as complicated as ears, nasal structures, eyelids, and more. It's going to be probably another 30 years or more before it's really honed to its ultimate utilization.
We talked a little bit about breast implants, and you were there, as I said, at the big bang of breast implants.
The initial credit must be given to Frank Giroux, who was a superb plastic surgeon. He was my junior resident, and he stayed on faculty. And actually, as the story goes, he was pumping blood into a patient in another procedure, and the Dr. Giroux noted that the feel of the silicone bag was very much like a breast. And so he got the idea that maybe we could develop an implant out of this. He talked to Tom Cronin, who supported research there, and both he and Tom went up to Milton, Michigan, visited with Dow Corning, and it ended up they developed the first breast implant. But how we put the first breast implant into a patient is another part of the story, David. The patient that we chose actually allowed us to do it because we had taken tattoos off her breasts successfully using a dermatome, and she was so grateful for the success of the tattoo removal that she said, I will be happy to be the first patient to have the silicone breast implant. What is fascinating to see is that that same patient was seen by me 30 years later, and she, to my best of my knowledge, is alive today.
I went to medical school at Hopkins, and I was on the residency training program at Hopkins for 2 years with Dr. Blaylock and Dr. Bonson and Frank Spencer and all those guys. Went to the University of Mississippi in Jackson to finish my general surgery training. It seemed to me as early as that point in time, which was 1962, general surgery was on the verge of no longer becoming general surgery. It was becoming abdominal and emergency room surgery. It had a repertoire of surgical procedures. I could not envision spending the rest of my career doing a repertoire of surgical procedures, which I would consider to be very uninteresting and unexciting. I wanted something more exciting and more innovative and more challenging than general surgery, and plastic surgery was it. I've always been interested in plastic surgeons older than I, to see what they thought about and how they came to be what they were, and have always therefore sort of sought mentors, to answer your question. I consider myself to be part of the last generation of plastic surgeons who did everything. And I think we were that. Fred McCoy and others like Fred did essentially everything. That is not true anymore, and that's been a major paradigm shift in plastic surgery.
My greatest joy was my residents. I had fantastic residents in general and in particular. And these kids were just like my children. I loved them. We learned together. Professionally, outside of that, I think the establishment of a first hand center at Barnes Hospital, which was controlled and in plastic surgery, the establishment of a cleft lip, cleft palate, craniofacial center, which eventually Jeff Marsh took over and ran, and the establishment of hand surgery as a significant part of plastic surgery.
I think of education as a continuum. You can start wherever you want to, but medical school, internship, residency, and usually general surgery, then plastic surgery. I think fundamental tenets of surgery are pretty much the same through that continuum once you start to be a surgeon. In plastic surgery, more of it meets the eye than in much of general surgery, which is visceral. But I think the same principles pertain. Those of a correct and appropriate diagnosis, and then the outline of suitable treatment. Those principles are the same in surgery and in plastic surgery.
Well, I think my greatest joy has been the people that I've operated and taken care of, and the people that I've trained. It's one of the nice things about living in a city the size of Springfield, is about 125,000, and operating on the people in Southern Illinois. You know, I hardly ever would go out to dinner, but somebody would come up and tell my kids how great a job I had done on taking care of them. And I don't think you find that very often in New York and Chicago. And the other thing was, when I went to Springfield, I interviewed and I went back to Indianapolis, and Dr. Bennett, who I was on the faculty with, asked me what I thought, and I said, I'm going. And he said, you're going to Springfield? There's nothing there. And I said, that's why I'm going. And now there are 12 plastic surgeons in Springfield. And at that time, there were 4 south of I-80. So, you know, plastic surgery has grown. Plastic surgery in Southern Illinois has grown. People don't have to go to Chicago and other towns to get their surgery. They can have it done there. And I think that's something that I feel very proud of contributing to. And the people that we've trained that are practicing around the country.
I've been very lucky. I got very involved in different parts of plastic surgery. So I was president of the American Burn Association. I was president of the Wound Healing Society, both of which I consider plastic surgery, but they really aren't anymore. So being able to be in leadership positions in fields that I thought needed a plastic surgeon in them has been very good for me. I think we will solve the immunology problem. We're getting close to that with the face transplants that Elof Erickson's group is doing at the Brigham. But I think eventually we will unravel it completely so that we can transfer any organ that's needed. And the hardest one has been skin, as you know, because of the immunology of the skin is tougher than the liver. But I think we'll solve that, and that'll make a dramatic difference in our specialty if we can go to the shelf and get anything we need and put it in, because with microsurgery and everything, we certainly know how to put it in. So I think that would be a, and then I did a lot of work with adult stem cells, and I think they will become a very useful product in the future so that we can make organs. If we don't have them to transfer, that we can actually make them.